Welcome to Sports Doctor. Sports Doctor is a live presentation, so we encourage you to call into the show and ask your questions on injury, rehab, training, or technique. We'll be taking your calls shortly. Call 767-8884 for your direct line to Sports Doctor. Here's your host for tonight's program, medical reporter Joe Chapana.
Good evening and welcome to Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Pennsville, and Washington Township. We're live for the next half hour. Tonight our topic is foot and ankle injuries, and we'll take your calls in that regard. Our toll-free number is 1-888-634-7488. To answer your calls tonight, we have Dr. Raymond Ferrara, who is a podiatrist with Family Foot Care Associates in Washington Township, and also Dave Anselmo, who's a physical therapist and owner of Cross Keys Physical Therapy, again in Woodbury, Pennsville, Washington Township, and Sicklerville. I want to remind you, too, that Cross Keys Physical Therapy is offering free evaluations for the next 2 weeks, and at the end of the program, we'll give you numbers to contact their various centers to take advantage of that offer. Right now, though, toll-free, 1-888-634-7488, as we talk about ankle injuries, foot problems. Dave, we'll begin with you. You've got the model there.
Sure.
Do some anatomy for us.
This is the right foot. Let's talk about this here. Let's go through the bones first. This is the tibia. This is the fibula on the side here. Okay, if you go underneath that, there's the talus. And this is the calcaneus. These muscles, this bones right here, this is the forefoot. This is the metatarsals, and this is the phalanges right here. That's a basic anatomy of the foot and the ankle here. This is
one common problem when you talk about ankle and foot injuries is a sprained ankle. And Dr. Ferrara, what actually goes on with a sprained ankle? What's happening?
Well, when you get a sprained ankle, what typically happens is that the person twists his foot in a manner that would go like this, in this type manner like that. Okay. And what you see is, right here, there's three major ligaments that connect this. There would be one from here to here, one from here to here, and then one from here to here. And what you usually see happens is that 1, 2, or 3, depending on the severity of the sprain, will get torn, stretched, or even ruptured. So if it's a person who, for maybe the first time, twisted his ankle, he'll just have a minor tear in this ligament right here. If it's someone who's a chronic nature or a severe sprain, maybe they fell off of a height or something, you'll rupture the tendon here and here. So as these heal, you'll get these painful adhesions or scar tissue that forms.
The tears, the ruptures, they eventually repair themselves? Is that?
Well, they can. What they typically do is that they will they'll scar themselves down. But sometimes these scars can be pretty painful. So what you'll see is, if it's not too severe of a twist and they just partially tear the front one, this will usually heal within 4 to 6 weeks. The more severe the sprain, and the more ligaments that are involved, and if they're torn, you usually look more at 6 to 8 weeks.
Okay, let's talk about rehabilitation for ankle sprains. Dave, what do you do?
Well, it really depends on several things. It really depends on what limitations does the patient come in with. I mean, not all of them are the same. That's not a cookbook effect. That's one thing I talk about at Cross Keys. We really like to give quality care in the sense that we treat the patient for what they need. And so if the patient comes in, it really doesn't have much swelling or doesn't have much pain, just really has limitations, we'll just work on that individual thing, whatever they need. And also it depends on the person. Is it a 60-year-old female that has a sedentary job that really just needs to be able to stand up and get to her job? We really don't have to do as much work with her as we would as an athlete who needs to get back into the play, needs to be able to do cutting and agility things. So it really depends on those type of limitations. We work on those individuals as an individual and work on their limitations.
Individual attention at Cross Keys Physical Therapy Sports Medicine Center, Sicklerville, Woodbury, Washington Township, and Pennsville. By the way, offering free evaluations for the next 2 weeks, and at the end of the program, we'll give you numbers to contact the different centers. Right now, though, if you'd like to contact us with a question about your foot, your ankle, we're available for you at 1-888-634-7488. Let's shift gears and talk about heel pain, Dr. Ferrara. What causes that?
Well, heel pain is something we commonly see in the office. And what that involves is, if you look here, there's a strong band, a ligament that runs from underneath these metatarsal heads all the way into the heel itself. And as a patient's foot stretches down and collapses, it pulls right here on this back of this bone, and this area becomes severely inflamed. And this over time can develop a heel spur.
Your hands right there. You go.
Right here. That's where you'll see the typical heel spur. However, you don't have to see that spur there to have pain. Just that pulling of the back of this bone right here will inflame the area enough to give you pain.
How do you treat a heel spur?
Well, there's many ways to treat it. One of the most common and conservative ways is by an oral anti-inflammatory that you take by mouth. So even things over the counter such as Motrin or prescription strength things that you'll see. That'll decrease the inflammation in this area. Another important thing is to support the area right under here with some kind of strapping device or an orthotic to prevent the pull of that ligament right on that bone. And if we can support that, it'll decrease that inflammation, and over time, the inflammation will just subside.
How long are we talking about?
Well, typically anywhere from 3 to 4 weeks. If the pain is consistent even on oral medication, what sometimes we can do is we can put a small amount of local anesthetic and steroid in there, and that'll just jumpstart the decrease of the inflammation.
Okay, ankle injuries, heel problems, foot problems, 1-888-634-7488. We'll take your calls. You're watching Sports Doctor, brought to you by Cross Keys Physical Therapy. Let's talk about footwear, and particularly women with that wear heels. A lot of them complain about pain in the back of their heels while wearing shoes. What causes this to occur?
Well, what you'll get here is in the back of a heel, especially on women when they wear high heels, this will elevate this bone right here. And right at the bar at the back of the shoe, it'll rub right in this area where this tendon inserts into this area. This can become severely inflamed, and it actually causes a bursa to form in that area. So right there is just that constant rubbing of the top of their shoe. And
what's meant by a bursa?
A bursa is just a fluid-filled sac, an inflammation, your body's reaction.
Okay.
So it'll just become inflamed.
What about footwear for runners? Is selecting the correct running shoe or even working shoe, is that important?
Oh, that is. Runners, we try to tend to wear a shoe that has a nice support in their arch, and also something that will absorb shock as they run. That's important to absorb shock, just not in the ankle joint, but as well as all the way up into the knee. As far as a work shoe, now, a lot of people who are on their feet all day long, like waitresses or bartenders, they want to have something that's just going to support underneath this area to help support their arch and keep it supportive right into this area right here. And I think that's the best thing.
Okay, before we move on and talk about flat feet, let's take a call from Norristown, Pennsylvania. Chris is on the line. Chris, welcome to Sports Doctor. Go right ahead with your question.
Yes, I injured my ankle back in February. I actually broke my left ankle and severely sprained my right. And it seems I've been having a lot of problems with it. I actually was treated for the broken ankle, and that healed, but I still have tightness in the left ankle. They're saying I have some ligament tears. They call them talofibular ligament tears. And I just wanted to know as far as treatment, because I'm finished with rehab due to the healthcare industry, and they'd say you only have 60 days of short-term rehab for that. And I just wanted to know where to go from there.
Okay. Question about this particular problem? Any comments?
Well, obviously, it depends on a couple different things. I don't know how far you got with your rehab. I mean, did your physical therapist hopefully give you any type of home exercise program that you need to be doing?
Yes, they actually gave me some stretching of the calves, toe raises, some things to help range of motion. But it seems like, I'm having spasms and still experiencing a lot of problems as far as my doctor telling me that the elasticity doesn't seem to be there with the tendons, where I'm prone to roll the ankle.
Okay. Well, it sounds like you're need to work on a couple different things, as well as when you work with your flexibility, you also need to really work on stability. So you really need to continue to work on the strengthening with, I don't know, hopefully he gave you some TheraBand to use at home as well, because you need to stabilize that ankle as well. A lot of times people start to do too much stretching. You said you're limited with range of motion, which is important, but you need to work on those things, but you really need to work on as well as the stability and the strengthening exercises, because you don't want that ankle to continue to give way on you. So I highly recommend you come into one of our offices, and we'll give you a real good check over and maybe put you on a better home exercise program with some TheraBand and give you some advice to take a better look.
Okay, Chris, we'll have those numbers for Cross Keys Physical Therapy at the end of the program. Right now, you can reach us toll-free, 1-888-634-7488, talking ankle problems, foot problems, and we're talking to Lamont from Philly. Lamont, are you there?
Yes.
Hi, welcome to Sports Doctor. What can we do for you?
Yes, I'm having this ankle problem. How would I solve it?
Mm-hmm.
Yeah, I know Sport Doctor really works, and it's really great.
I think we lost Lamont from Philly. Let's talk about flat feet, Dave. We hear people say, flat-footed. What is that?
Well, as the doctor nicely explained about how important the arch is, and this is a normal support. You can see the arch support there. See how the foot is going up. That's a normal arch of the foot, and that's something that some people have no problem with that. And what we really like to do is we like to have tell people to get shoes that really support that and maintain that. And some people don't do that and have a tendency to get what they call, this is a flat foot, where the arch will actually collapse. You can see the difference between the two. Let's turn it this way. Here you go.
Good illustration there.
Here you go. See the difference in the normal one and the flat foot. The arch actually collapses. The plantar fascia will actually collapse, and there's really no support there. It just goes flat.
All right, let's grab another phone call, this time from Atlantic City. Herb, welcome to Sports Doctor. Herb, how are you?
Fine, thank you. Enjoying the program. Wanted to ask regarding footwear, is there any advantage to athletes or some of us non-athletes of wearing these special shoes? There's a well-known German manufacturer that makes shoes with a cork bottom that are actually sculptured to fit your foot and your toes. They're like clogs, but they're very well-known. They're expensive, and I'm just wondering. I have a pair, but I just bought them. But I'm wondering, is there any advantage to? I know an athlete can't wear these while he's performing athletics, but is there any advantage to wearing these when you're off or when you're walking? Or
Have either of you heard of these type of shoes? I've never had.
I have.
You have?
Yes, they're actually shoes that are tried to design to go into the ridges from your metatarsals all the way up to the smaller bones in your foot. And the theory is that not only is it supporting the arch, but it's supporting the forefoot as well. I think that they help, maybe more in an athlete compared to someone who maybe uses it just every day. But it's not a very popular shoe type. So I don't have a lot of experience. A lot of people really haven't used them as much for me to have an opinion on that.
All right, Herb, let us know how you make out with those, okay? Toll free, 1-888-634-7488. We're talking ankle injuries, foot problems. We have Dr. Ferrara with us and also Dave Anselmo. And on the line, we're going to Pennsville now. Our next caller's name is, what is it? Barb, I'm sorry. I couldn't quite make that out. Welcome to the program. Barb, are you there?
Yes, I am.
Hi, how are you?
Okay.
What can we do for you?
Okay, I have my foot has been bothering me. I have high arches, and I use that Body Flex Plus band for the exercise, and I think I somehow injured my foot, and I was wondering what I can do for it, besides putting ice on it.
Uh-oh.
Well, Barbie, you're a perfect person to take advantage of the free evaluation down in Pennsville. I recommend you to take a look at, just call in and you come into the office and I'll take a look at you and give you a better understanding of what's happening with you. Maybe it might be something basic, a couple stretches and some icing and so on and so forth that maybe will straighten you out.
Okay, Barb, thanks for watching. Thank you for the phone call. And at the end of the program, we're going to give you the numbers to the different Cross Keys Physical Therapy Sports Medicine Centers, including that one in Pennsville. Right now, let's move on and talk to Ken in Wilmington. Ken, are you there?
Yes.
Kenneth, how are you?
I'm doing fine.
What can we do for you?
What I'm calling about, I fractured my talus back in 2001, and I had 3 ankle surgeries, and they want to do a 4th ankle fusion. So I want to know, what do you think about having an ankle fusion?
Ankle fusion.
Well, fracturing your talus is, it's notorious, if we look right here, it's notorious for going on to what's called avascular necrosis, which is dying of the talus. Also, whenever you fracture the ankle itself, there's a high percentage of arthritis. And patients who have severe, the more severe the arthritis tries to dictate your course of treatment. If it's becoming to the point where you're looking at fourth surgery, an ankle fusion, in theory, is to try, instead of having that little bit of motion that you're going to get, that pain, an ankle fusion is trying to eliminate all the motion in that area. The only disadvantage to an ankle fusion is that some of the joints higher up in the leg, the knee, are gonna suffer from the fact that there's lack of motion down at the ankle. So for these type of injuries, it's not that it's a bad thing, but you just have to be aware that if you have an ankle fusion, that you may experience arthritis in other joints.
And Ken, the good news is right across the river from you in Wilmington, there is a location of Cross Keys Physical Therapy in Pennsville. They're offering free evaluations for the next 2 weeks. We'll give you numbers for that at the end of the program. We have Craig Holding on the line from Bucks County. We're going to come right back to you, Craig. It's Chris, actually. I'm sorry. We're going to take a short break and come back with more of Sports Doctor right after this.
Sports Doctor will be right back.
Hi, I'm Kevin Ross from the Kansas City Chiefs. When I need physical therapy, I chose Cross Keys Physical Therapy, one of the leading rehab centers in South Jersey.
Cross Keys Physical Therapy offers aquatic therapy programs in a heated pool that will help you strengthen weak muscles and improve your flexibility. Our highly skilled physical and occupational therapists are experienced with working with athletes and non-athletes alike. So if you need to get back to work or back to play,
Cross Keys Physical Therapy.
Sicklerville, Washington Township, and Woodbury.
By Mom. I can't see.
he can't see.
Come on, baby.
Is that good?
Daddy, I don't want to be on the end.
Marriage, you're never too far apart when you're still holding hands. From your neighbors, the Church of Jesus Christ of Latter-day Saints.
It is Sports Doctor, brought to you by Cross Keys Physical Therapy Sports Medicine Center in Sicklerville, Woodbury, Washington Township, and Pennsville, offering free evaluations for the next 2 weeks. At the end of the program, we'll give you numbers to contact them and take advantage of that free offer. Right now, though, you can call us toll-free at 1-888-634-7488. Your questions about feet or ankle problems. And waiting for us from Bucks County, we have Chris on the line. Chris, are you still there? Chris,
yes,
hello.
I'm here.
Hi, thanks for waiting. What can we do for you?
Okay. Sure. I broke my fifth metatarsal back in March. I was walking on a broken foot for probably about a year, and I found out that it had fractured and the bone had broken off, and they ended up putting in about like a 2-inch screw in there to replace the bone. And now, you know, the bone calcified, and I can walk around on my foot okay, but I get a lot of pain, especially with the weather and whatnot, and I don't know if I should get that pin removed, because I talked to a doctor that I'm friends with out in California, and he says that he always takes the pin out, and I just don't know if you think that's necessary, because my doctor told me that he didn't think I needed that.
Okay, pin in, pin out. Any thoughts?
Typically what I do is I try not to remove too much hardware unless the hardware itself is becoming painful. There's really no disadvantages to taking it out, and there's really no advantages to leaving it in. Most doctors leave it in unless it is painful. If it's not hurting you, if that pin itself is directly not hurting you, you probably would be best just to leave it alone. If that pin itself is starting to back out of the bone and it's irritating you underneath the skin, then that's certainly a reason to have it removed.
Any problems at the airports with those things going through security?
Not with the little ones, but
Okay.
sometimes some of those bigger ones.
Okay. Now they make you take your shoes off and everything. That's something. Next caller is from Egg Harbor. We've got George waiting to talk to us. George, are you there?
Yep.
Hi. What can we do for you tonight?
Okay, I can hardly hear you.
We can hear you, so go right ahead.
Okay, I'll just briefly go ahead. Back in 1991, I had a left ankle fusion done at a local hospital. And I saw my orthopedic doctor the other day, and all of a sudden I found out that I have a deformed joint in my left ankle. I have a history of plantar fasciitis, also flat feet. And he said I may have to try a bilateral arch support. I don't know what bilateral arch support is. I'm trying not to play stupid or anything, but I don't know what it is.
Don't feel bad. I don't know what it is either. What is that?
Bilateral arch support?
Yes.
That really just means arch supports in both of your feet at the same time, so you support underneath both of them. The best way to do that and the easiest way is to have orthotics made for you.
So there you go. Hopefully that'll work. Thank you for the call. And I also want to remind you about the free evaluation offer from Cross Keys Physical Therapy. Hang on. At the end of the program, we'll give you the numbers. Right now, toll free 1-888-634-7488 from Maple Glen, PA. We have Linda. Linda, welcome to Sports Doctor.
Hello.
Hi. How are you?
I'm good. How are you?
Good. How are your feet?
Oh, it's not me. It's my husband.
Okay.
He had a septic ankle, and he had some orthoscopic surgery done on a week ago Friday. So he's doing good on the recovery, but we're not quite sure about the swelling and how long that usually takes to go down, and how aggressive the treatment should be for the whirlpool and walking on it. I think the doctors expect him to start to, put pressure on it and walk around, but it's still a little tender. And, he did some pool exercises yesterday, and today it's, he put some pressure on it, and it's, swelled back up a little bit on him.
Mm-hmm.
So do we go and maintain the therapy that he's doing, or do we lay off it a little bit, or what do we do with that?
Okay. I know aquatic therapy is featured.
Well, obviously, it's normal, believe it or not, when you start doing stuff like that for it to swell up again a little bit. I mean, because you're putting more stress on that ankle joint, and the soft tissue around the area reacts that way sometimes. So it's quite common to have that happen. I wouldn't stress it out or get all nervous about it. I recommend you to continue on with your therapy, and if you're in the water, it's excellent as well, because you're really not putting as much stress on an ankle as you think you are being in the water, because of the buoyancy of the water. At waist level, you're decreasing your weight-bearing effect by like 50%, and at shoulder level, you're decreasing by 90%. So if you're looking at what type of level he's in the pool, hopefully you're really not putting as much stress on it, but it's real important to get it moving and to move that swelling out of there.
And I know you feature aquatic therapy at your centers in Washington Township, Pennsville, and Woodbury.
That's correct.
And all centers are offering free evaluations for the next 2 weeks. Hang on, at the end of the program, we'll get to those numbers. Let's move on to another phone caller from Pennsville. Jeff is on the line. Jeff, are you there?
Yes.
Hi, what can we do for you, Jeff?
Yes. I got a question for you. I have pins and needles in my feet all night long. I shake my feet all night.
Mm-hmm.
I've been through doctors and doctors and doctors. I knew I could figure out what's going on. I take aspirins, I take Tylenol, everything. Nothing works. I shake them constantly.
Okay.
It feels like pins and needles in the bottom of my feet.
Okay, pins and needles. Is that a symptom of anything?
That could be it could be a number of symptoms. It could be from a tarsal tunnel, which is the nerve right here being entrapped. Where exactly is the pins and needles?
In the arch of my foot.
In the arch of your foot?
Yes, in the bottom.
Okay. If you tap on the inside of your ankle, does it reproduce that pins and needle sensation?
No, not that I know of. I mean,
not that you know of?
Do it now.
Yeah.
Live.
Take your shoe off fast.
Well, it's hard to say what it is without evaluating you.
Of course.
It could be anything from. It seems. How old are you?
40.
You're 40?
Yeah.
Do you have any kind of history of any kind of diabetes or any kind of neuropathy?
No.
No history of any back pain?
No.
Well, it certainly is worth for you to getting it fully evaluated. It's really hard to say. There's a number of things that can cause this kind of sensation. Most commonly, it's some kind of trapped nerve in your foot or your ankle.
Okay, and again, Jeff, they are offering free evaluations at Cross Keys Physical Therapy, including the one in Pennsville. And at the end of the program, we'll give you numbers to schedule an appointment. Let's move on. Bucks County, we have Lindsey on the line. Lindsey, welcome to Sports Doctor.
Hi, thank you. I have a quick question. I continually tear in my right foot my plantar fascia, and I have orthotics, which are supposed to be supportive and keep it from tearing. I also wrap it up, but I continue to tear it over and over again. I'm not sure what I should do.
stop tearing it, I guess would be the one thing. But what?
Well, how many times have you torn it?
Well, I get like a lump. It's almost like a lump of tissue on the bottom of my foot. And I play basketball and soccer around the year, and I've torn it about 3 times this year.
And that's the plantar fascia in the bottom of your foot.
It's like a part. It's not like fully torn, but
It was a
lot
partial
of
tear?
it's torn. It's like partial.
I mean, the best thing you can do that's, without going into the operating room, is to support that area. Even so it's torn, if you can put some kind of supportive device underneath that, that's just going to take take the stress off of that area. So it shouldn't be as inflamed as it is if you keep tearing it.
Lindsey, thank you for watching. Thank you for the phone call. Let's take another call from Woodstown this time. Monica, welcome to Sports Doctor. Monica, what's your question, please?
The balls of my feet throb sometimes, and I was told that the arches fell there, and I wanted to know what I could do about that.
What part of your foot throbs? I'm sorry?
The ball of my feet.
The ball of your feet throbs.
The ball of your foot throbs?
I think that's what she's saying, yes.
Oh, okay. Again, the best way to be accommodative at any time if you have this throbbing pain in the ball of your foot is to wear nice shoes with some cushion in the area and a nice arch support. If that doesn't help, you can go all the way into any kind of inserts that you can buy in the local stores, or as well as having custom-made orthotics to support that area.
Okay, Monica, thank you for the call. Thank you for watching. We're going to put the numbers up for Cross Keys Physical Therapy Sports Medicine Center. Again, offering free evaluations for the next 2 weeks. And all you need to do is call and schedule an appointment. In Sicklerville, you can do that at 856-728-1900. Washington Township, it's 856-374-3707. Woodbury, it's 856-853-0988. And in Pennsville, 856-678-8000. I want to thank our guests for joining us tonight. Dr. Raymond Ferrara, a podiatrist from Family Foot Care Associates in Washington Township. First time on the program, did an excellent job. And also the veteran Dave Anselmo, who is a physical therapist and owner of Cross Keys Physical Therapy. Again, in Sicklerville, Woodbury, Pennsville, and Washington Township. We're taking a break for our next program. We'll be back in September. Until then, I'm Joe Chapana for Cross Keys Physical Therapy. Stay well.